Hello everyone, welcome to M3 Academy. This Rickettsia topic already covered in our Telegram group, but some members are joined late and requesting about the Telegram session, so we are recording in the Telegram. So Rickettsia is also super 100 topics by M3 Academy, so which have 100% predictability in your exam. So Rickettsia, let's start from this table. So Rickettsia has three groups: typhus fever group, spotted fever group, and a scrub typhus fever group. First of you know this group, typhus, spotted, and the scrub typhus. Now the typhus fever group has two members, Rickettsia prowazekii and Rickettsia typhi. How you remember? Has the typhi is T for typhi, Rickettsia typhi T for T, P means prowazekii. तो रिकेट्शा में क्या होते हैं? रिकेट्शा में होता है टाइफी एंड प्रावाजाकी। इसके बाद अपन देखते हैं जब प्रावाजाकी रिकेट्शा प्रावाजाकी, सो पी इन टाइफी पी मीन्स प्रावाजाकी एंड पी मीन्स पेडिकुलोसिस corporis and pediculosis capitis means pediculus is a vector, pediculus another name of pediculus is a louse is a louse. Again, P, you can remember the disease is epidemic typhus because epidemic typhus is a second letter P. So यहाँ पे second letter क्या है epidemic में P. So और पेडिकुलस मीन्स लाउस है उसमें भी P आता है और प्रावाजेक भी P है और टाइफस भी P है। तो इन सब P से अपन समझ सकते हैं कि सब एक ही से जुड़े हुए नाम है यहाँ पे। अब आगे अपन देखते हैं इसमें कि जो एपिडेमिक टाइफस है एपिडेमिक टाइफस E for except P for palm and sole. So in the case of the rushes distributed all over the body except palm and sole. How we remember this epidemic itself we speak about E for except P for palm and sole. So palm and sole are not involved in the case of the rushes in the epidemic typhus. Is that clear? Now, next thing is the Rickettsia typhi, or another name is the Rickettsia museri, because nail muser reaction are the positive. So, Rickettsia museri or Rickettsia typhi. So, as the name suggests, typhi, you can read as a typhi Fi. So, Fi means flea. So, rat flea is the causative agent. And as you know, where rat, rat live inside the home. रेट कहाँ रहते हैं? जो चूहे होते कहाँ रहते हैं? घर के अंदर रहते हैं. अंदर inside the home means endemic typhus caused by the red flea, or you can remember like T fent. T means typhi, fent, P means flea, ENT means endemic typhus. So you can also remember this mnemonic T fent. तो इसलिए जो टाइफी है या टाइफी का दूसरा नाम क्या है? मूसेरी, मूसेरी। और टी फेंट से आपने याद किया एफ मीन्स फिलिया, ई मीन्स एंडेमिक, टी मीन्स टाइफस। तो एंडेमिक टाइफस और इसका नाम क्या है? मूसेरी। तो इसलिए जो रिएक्शन इससे होगी वो म्यूराइन टाइफस इसको बोलेंगे और इसमें ट्रंक इन्वॉल्व होता है, उसके बाद एक्सट्रीमिटी पे रशेस आते हैं। अब यहाँ पे अपन देखते हैं वेल फ्लिक्स रिएक्शन। तो इन वेल फ्लिक्स रिएक्शन देयर इज OX19 पॉजिटिव एंड 2 समटाइम पॉजिटिव, 2 समटाइम नेगेटिव. So 19 is the top number in the OX-Felix reaction, and OX-Felix reaction, as you saw in this table, the top position by the typhus group. So top number 19 is a positive. Is that clear? अब इन दोनों के केस में अपन देखते हैं in the typhus fever group there is a no scar, no lymphadenopathy, but there is a CNS involvement means mental confusion and coma. How we remember? As you see in this table, the top position is gained by the typhus fever group, and in our body the top position is gained by our head or our CNS or our brain. So top are related. So top position by typhus fever group and top position our body by the head, brain or CNS. So CNS symptoms are seen in the typhus fever group. CNS symptoms means mental confusion and the coma. And we are talking about one more disease, Brill-Jensen disease. So what is the Brill-Jensen disease? If Rickettsia prowazekii become latent in our body, if somebody get affected by the epidemic typhus or infection by the Rickettsia prowazekii, and after some time this prowazekii become latent in body and again reactivated after some time. So by reactivation of the Rickettsia prowazekii give the disease Brill-Jensen disease or the gel fever. So Brill-Jensen disease is nothing as the Brill-Jensen has R, so R for recrudescence of the epidemic typhus. So causative agent are the same, just name is different. Brill-Jensen disease or recrudescent disease. So we can say recrudescent typhus. So in examination there may be a name recrudescent typhus means Brill-Jensen disease, gel fever. Is it clear? Now now the third thing is a nail Musser reaction. So in endemic typhus you can see N The near letter N is M, so murine typhus, also known as endemic typhus, or N for Nell-Muser reaction, or N for tunica reaction. The tunica reaction are positive in endemic typhus or the Nell-Muser reaction. Now, what is the Nell-Muser reaction? When we are injecting this rickettsia in the body of the guinea pig, it can causes fever and the scrotal inflammation. So in case of rickettsia, rickettsii is only produce scrotal inflammation R4R. In case of rickettsia pravazak, it only produce the pyrexia means fever. And in case of the cat, cat means coronary, artery and typhi. Cat it produce fever with a tunica reaction. Tunica means testicular inflammation. So testicular inflammation may be appreciated in the cat, coronary, artery and the typhi. So just cat याद करना है और tunica reaction आपको पता चल जाएगा. तो ऐसे अपन यहाँ पे कवर किया टाइफस फीवर ग्रुप, टाइफस फीवर ग्रुप. इसके बाद अपन यहाँ पे देखेंगे स्पॉटेड फीवर ग्रुप. Spotted fever group. So you can remember in spotted fever group there is a scar. S for spotted, C for coronary, A for hair artery, or R means rickettsia. So scar, C for coronary, artery, and Africa and rickettsia are the member of the spotted fever group. अब इन spotted fever group में अफ्रीकी इसमें जो आकेरी है वो अकेला है, अकेला अलग चलेगा, आकेरी अकेला अलग चलेगा, बाकी सबके फीचर यहाँ पे सिमिलर रहेंगे. कैसे याद कर सकते हैं? आकेरी गोज अलोन मीन्स इट हैज डिफरेंट vector and different diseases. Now, the first member is Rickettsia. Rickettsia causative agent is a tick. Vector is a tick, and agent is a Rickettsia. Rickettsia. The disease is Rocky Mountain spotted fever, and the most severe rickettsial disease is Rocky Mountain spotted fever, and it involves extremity, and it is extremely severe. How you can remember? See this picture. This is a rock and this is a mountain. So this is a rocky mountain. This is a rocky mountain. Rocky mountain. If somebody try to climb the rocky mountain in this situation, this is a very difficult situation. The person may die after imbalance. So patient may die. So there is a danger. So dangerous disease. So most severe disease is Rocky Mountain fever. Rocky Mountain fever. And the person climbing by using his palm and sole. So palm and sole are the involved in the Rocky Mountain fever. And you can remember like rock talk. इसको रोकना पड़ेगा. Rock talk means tick is a vector. And extremely severe disease and extremity are the involved is the Rocky Mountain spotted fever. Now next thing is the Rickettsia coronary. Coronary, you can remember like Indian corner. India is in corner. So Indian tick typhus are caused by the Rickettsia coronary, as the name suggests, tick is a vector here. Tick is a vector here. There is a three name for Rickettsia coronary or Indian tick typhus, which is BMI, Boutonese Rickettsia, Boutonese disease or Mediterranean spotted fever, and I for Indian tick typhus. You can remember by this image. This is the Indian beautiful maid, which has the kitchen instrument is palm and sole. So Indian means Indian tick typhus, maid means Mediterranean spotted fever, beautiful means Boutonese fever, and it has the instrument kitchen instrument in palm and sole. So palm and sole are involved. This is a Indian made, beautiful Indian made. So you can remember in this way. Now the in the both cases, Rocky Mountain spotted fever and Indian tick typhus, palm and sole are involved. So how you can remember? The person use palm and sole for climbing the rock, and the maid use palm and sole for the homework, housework, kitchen work, household work. So palm and sole are involved. Now next thing is the Rickettsia africae. Again the vector same for the tick, and again as the name suggests, africae tick bite fever are caused by this. An African tick bite fever. Now next is the Rickettsia akeri. Akeri means akela. Akela means Hindi in alone. So alone in the group of the spotted fever group, not by the tick, it by the mite. The vector is gambicid mite. And disease is rickettsial pox. So if somebody affected by rickettsial pox, his shape of the face is disfigured. Shape means the akar. सो यहाँ पे आकेरी क्या करता है, फेस का आकार बदल देता है। तो फेस का आकार किसकी वजह से बदलता है, जब किसी को पोक्स हो जाता है। आपने देखा होगा किसी को चिकन पोक्स हो जाता है तो फेस पे छोटे छोटे निशान बन जाते हैं और फेस का आकार बदल जाता है। इसी समझ से यहाँ समझ सकते हैं आकेरी मीन्स आकार, आकार मीन्स फेस, फेस आर चेंजेस बाय दी पोक्स, स्मॉल पोक्स। और यू कैन रिमेंबर लाइक आकेरी, पाकेरी, माकेरी। सो आकेरी, पाकेरी, माकेरी, Akeri means Akeri, Pakeri means pox, Makeri means Gambicid mite. So in this way you can remember. So we now uh, African tick white fever and the rickettsial pox. As you know, pox like chicken pox, so there is a lesion in the form of vesicular or varicella reactions. Is it clear? Now the Weil-Felix reaction. Weil-Felix reaction, first of all, first for the highest number is positive OX19, and in case of the spotted fever group, if you leave the Akeri, for rest, both two are positive, 2 and the 19 positive. Akeri is the alone, so nobody with is alone, so it goes negative. Depressed mind, so all three negative. Well-Felix reaction, all three negative. अब अपन बात कर लेते हैं स्क्रब टाइफस की। स्क्रब टाइफस आर स्प्रेड बाय ओरेंटेशिया टुसुगामुसी एंड ट्रोम्बोकुलेट माइट। So how we can remember? See this picture. After susu, you are doing hand scrub. After susu, you are doing hand scrub. Susu means tusuga musi, and scrub means scrub typhus, and scrub typhus. T for trombiculate mite hair, trombiculate mite hair. And what is the status of the Weil-Felix reaction? Read scrub like scrub. SKURB K for K positive in the scrub typhus. Is that clear? So, we have covered this Rickettsia table in one shot. So, the mildest form the Rickettsia is the rickettsial pox, only the skin lesion. So, mildest form of the Rickettsia is the pox. Is that clear? So when you are in alone, you are start playing the mobile game. Alone means akeri, and start playing the mobile games. Playing means pox, mobile game means गैम्बसिड माइट। तो जब आप अकेले रहते हैं घर पर तो क्या शुरू कर देते हैं, मोबाइल गेम खेलना शुरू कर देते हैं। मोबाइल गेम मीन्स गैम्बसिड माइट फॉर दी पॉक्स, और अकेले रह रहे हैं मीन्स आकेरी, रिकेट्सिया आकेरी। ये सबको क्लियर है? इसके बाद वाली स्लाइड्स पर अपन आपको लेके चलते हैं। जो टिक और जो माइट होते हैं, टिक और माइट होते हैं, वो बाइट करते हैं और ट्रांसओवरियल ट्रांसमिशन उनमें मिलता है। लाउस एंड जो फिलिया होते हैं वो ऑटो इन्युकुलेशन कर सकते हैं और एरोसोल से भी डिजीज कर सकते हैं। ड्राई लाउस यदि एरोसोल से आप इनगल्फ कर लें। नेल म्यूसर रिएक्शन वी ऑलरेडी डिस्कस्ड, and drug of choice for all rickettsial diseases are doxycycline. If doxy not available, you can give the chloramphenicol. So just you can remember by C and D, chloramphenicol and the doxycycline. Well-Felix reaction is a heterophile agglutination test, is a tube agglutination test, and 2 and 19 we are using OX2 and OX19 of the Proteus vulgaris and K for the Proteus mirabilis. How we remember this? 2% in the age of the 19 year can give vulgar activity. 2% at the age of the 19 year doing vulgar activity. So 2 OX2 and 19 are Proteus vulgaris. On OXK for the Proteus mirabilis. Is it clear? Both are the non-motile strain of the Proteus. It show antigenic things with the rickettsia, so heterophilic tube agglutination test. Now, the Weil-Felix reaction is negative for Akeri. We already know अकेला है negative रहेगा. Again, rickettsial pox is negative. Q favor has a question for the Weil-Felix reaction means negative. Ehrlichiosis means E for absent. Bartoniosis B for block means absent. Now, the most important disease is the rickettsia. In the rickettsia is the scrub typhus. Each and every question you can see, because the most common country for the scrub typhus is the India. Is that clear? So question are asked the most of the time. So rickettsia is spread by Tsutsugamushi. Scrub typhus is spread by the Orientia Tsutsugamushi, caused by the Tsutsugamushi. So how you remember this? See this picture. After Susu you are doing hand scrub. So Tsutsugamushi causing the scrub typhus. Scrub typhus. So scrub typhus caused by Orientia Tsutsugamushi, and its lack LPS in the cell wall affect mainly military population. Mite from T you can remember like trombiculate mite, and Chigger stage of larva in the human, so इसका दूसरा नाम हो जाता है चिगेरोसिस. इसलिए स्क्रब टाइफस को ही अपन बोलते हैं यहाँ पे चिगेरोसिस. Mainly is transmitted by the transoviral transmission. So here is the key word is the T. Tsutsugamushi, tromboculate, mite, and transovarial transmission all started from the T. Now next thing is the triad. What is the triad here? Triad is a Midnight Express revision you already know. So M for maculopapular rush, E for Eschar, and R for the regional lymphadenopathy. Triad seen only 50% cases. Now some systemic symptoms like fever, headache, myalgia are seen, and there is a five antigenic types which are Borian, Gillian, Karp, and Kawasaki. Now next thing is the zoonotic tetrad. So zoonotic tetrad is essential to maintain Orientia tsutsugamushi in the nature. So, what is the zoonotic tetrad here? Mite, mice, and scrub vegetation and the season. How we remember? Mite, mice, and scrub means massage. So, massage, and wet season means monsoon season. So, monsoon. Now, most common rickettsial disease in India is scrub typhus. Most common rickettsial disease in India is scrub typhus. So, it is most common question asked in exam by Indian examiners. Is that okay? So now, Weil-Felix reaction, the positive antigen is K as a scrub K. Is it clear? But if we ask most specific and gold standard investigation, then our answer is indirect immunofluorescence. Is it clear? Now next the Q fever. Q means query. Has so many queries, so many question uh, on the Q favor. What is type of the question? Coxiella burnetii. So there is a question on the vector. So no vector is spread by airborne. And also question on the Weil-Felix reaction. So negative reaction. Question on the rush. Is rushes in the question? Answer is no, no rushes. So no vector, no Weil-Felix reaction, or no rushes. So what is the reservoir is cattle. Q fever means cattle. Now the louse trap in the hair. Louse trap in the hair. What is the disease caused by the louse? Louse trap in the hair. TR means trench fever. RA means relapsing fever or epidemic typhus are spread by the louse. Now some point about the trench fever. It also known as the 5-day fever, and only rickettsial disease can be cultivated, and Borentella quintana can be transmitted. So Borentella quintana, how you remember? Borentella ST quintana. Borentana is T, Quintana is T, Trench is T, so all are spread by the TTT T. now एक और कैसे याद कर सकते हैं? T को ऐसे L बना सकते हैं, L बना सकते हैं, L. सो ट्रेंच फीवर लाउस से स्प्रेड होता है. तो ये सब आपको क्लियर है यहाँ पे. जैसे इसका जो भी सेशन हमने लिया अभी, इसका आप फ्लैश कार्ड बनाएंगे और हमारे टेलीग्राम ग्रुप पर भी पोस्ट करेंगे. ये सुपर 100 टॉपिक्स में से एक है. सो थैंक्स फॉर वॉचिंग.